Hello, I'm Dr. Bains. I want to talk to you a little bit about longevity for men and how it's different from what's happening out there, what's happening within the NHS, and how it's also different from women. Now, the lucky thing for you is that almost all research, majority of research that's done on longevity has been done on men. And therefore, a lot of the data that we have is relevant to you. However, a lot of people think of longevity for men as testosterone replacement therapy, and India hits that's about it. And whilst that's quite an important part of longevity, it's not all of it. And not only that, if you were to think about how TRT is actually initiated outside of a private clinic setting, it's the criteria are usually very stringent. The range of what's called normal is extremely wide. A lot of people who face all the symptoms of it generally don't get treated because they're just not sick enough, so to speak. And that's not the right way of looking at it. You have to think about it in terms of optimizing and not just normalizing. It's two completely different things. You have to think of it like that. On top of that, you have to think about, when you think about longevity, you have to think about what kills you as fastest. I mean, in a very simple matter of speaking, that's what we have to look at. So cardiovascular diseases and metabolic diseases are some of the main things that we have to think about for men. And another very big one, but not spoken about quite as much, is really mental health and everything that encompasses for men. So these are some of the things that we need to be looking at. We need to target specifically, and we need to do a deep dive. A lot of which is not available on in conventional medicine, mainly because of the amount of resources that it takes, not because they don't want to. And this is where we step in, because we look at all of these things, and where possible for the right person, we want to look at your DNA, your genetics, personalize it to you, think about your family history, put all of that into play, and create something quite bespoke just for you. And this is all possible. So what you do today would count towards what's going to happen to you in the next 10 years, 15 years, 25 years, and it really, really makes an impact. The typical age range that we see usually starts from about mid 30s onwards, all the way till people in their 70s and 80s, which is wonderful. So there's no such thing as too early or too late, I would say, for this, because it's preventative in nature. Think about what you can do today. Think about how, with a little bit of outside help, we can target it and personalize it just for you, so that what you do today has really a lot of long-term benefits for the future.